All right, so we're going to continue talking about the cardiovascular system, and we're going to start talking about blood pressure. And we're going to have two videos on blood pressure. In this first one, we're really going to introduce it, talk about primary factors that affect it. And then in the next video, we're going to talk about specific things related to different parts of the cardiovascular system that will affect blood pressure. So here are the outcomes that we have for this video. And so to start off, we need to remember the relationship between blood flow, blood pressure, and resistance. Now, just in general, when we're talking about flow, we're talking about the movement of some sort of fluid over time. So generally, the units are volume per time. When we're talking about flow in the cardiovascular system, we're talking about cardiac output, which you should recall from a couple of videos ago. Remember, that's just heart rate times stroke volume, and that tells us how much blood's leaving the heart every minute. Then there's blood pressure. And so blood pressure is just giving us an idea of how much force that blood is actually exerting on the vessel walls. And so when we talk about blood pressure, we're generally talking about pressure in the arteries, but we have blood pressure all throughout the cardiovascular system. But when it comes to blood pressure that they measure in the doctor's office or at the little machines like in Walgreens or CVS, this is measuring blood pressure in your arteries. And at the end of the day, your body's not really concerned about systolic or diastolic blood pressure, but it's concerned with mean arterial pressure. And then finally, there's resistance. And as we've gone throughout this semester, we've talked a lot about resistance. Remember, resistance opposes flow. And so resistance just is letting us know, is it easy or is it difficult for something to flow? And so when we're talking about the cardiovascular system, we're talking about total peripheral resistance, and we'll talk about what specifically or where specifically that resistance comes from. And we'll start with that here. Now here we've got an equation that talks about resistance or allows us to calculate resistance. Okay, and so it's 8 times mu times L all divided by pi r to the fourth. Now you'll never need to use this equation in my class, but I want you to at least have an idea of what's in it because these things tell you what adds to resistance. Okay, and so one of the thing that has the greatest effect on resistance is radius. Okay, and that's because it's raised to the fourth power. And so if you increase radius, you actually decrease resistance. And the opposite is true. If you decrease radius, you increase resistance. Now I've got a picture of milkshakes here. I love a good milkshake. I'm striving to find where the world's best milkshake is. Got a lot of work to do there. But if you went into Steak and Shake or some other place that makes shakes, and they said, hey, you can have a fat straw or a skinny straw to enjoy your shake, you would likely choose the fat straw. And the reason why you would do that is because there's less resistance, and so it's much easier for you to enjoy your shake. You don't have to generate as much pressure to be able to get it up through the straw. So if you go back to that equation, there are multiple variables. And so one of those is viscosity, which was mu, and then you've got length, which was L. As viscosity and or length increase, that increases resistance. And so when we talk about viscosity, we're just talking about how thick the fluid is. Okay, again, going back to the milkshake analogy, it's a lot. You have to generate more force to get milkshake through a straw as opposed to soda. And then you've got vessel length. The longer the tube, the greater the resistance. Okay, and so if you've got a really, really long straw, you're going to have to generate more force to enjoy whatever your beverage of choice is. Okay, this is also why you can't have a super long snorkel. You can't have an 8-foot long snorkel. There are multiple factors, but one of them is just you can't overcome the resistance that would come with an 8-foot snorkel. So this leads us to the arterioles. Now, arterioles are known as resistance vessels because they can change their radius or their diameter, and as a result, they have a huge effect on mean arterial pressure. Remember, from that equation that I showed you a minute ago, radius has the greatest effect, and since arterioles can really change the radius, they have a huge effect on mean arterial pressure. Now, when they change their radius, they're either undergoing vasodilation or vasoconstriction. Vasoconstriction means that they're getting smaller, so you're going from a fat straw to a skinny straw. Vasodilation means the exact opposite. You're going from a skinny straw to a fat straw. Vasoconstriction increases resistance. Vasodilation decreases resistance. Now, when it comes to how these resistance vessels are controlled, meaning factors that affect their diameter, we can break this up into 3 different categories. So you've got local. So things such as temperature, oxygen and carbon dioxide content, or just blood flow through that specific vessel will affect their radius. Okay. One of the things that you're likely experiencing, it's summer, it's 90 degrees outside. Many of you probably have noticed that your fingers tend to swell in the heat. Well, what's happening is your blood vessels in the skin of your extremities are dilating, and that allows more blood flow through them so you can get rid of heat. Okay, so high temperature leads to vasodilation, low temperature leads to vasoconstriction. Low oxygen causes vasodilation because we're trying to get more blood flow there. Okay, then you've got hormonal control, and we're going to talk about more of these later on in the semester. But you've got hormones such as renin, angiotensin II, or vasopressin, and all of these can have an effect on whether or not these vessels vasoconstrict or vasodilate. The upper bullet point with renin and stuff, that causes vasoconstriction, whereas atrial natriuretic peptide generally causes vasodilation. And then finally, you've got neural control. And so this is just a signal being sent from a neuron to blood vessels telling them to vasoconstrict. Usually that's what happens when we have high sympathetic activity. And so this equation will help you remember the relationship between pressure, flow, and resistance. Okay, so flow is denoted by Q, pressure, P, resistance, R. Okay, and so flow equals pressure divided by resistance. We can go back to the very first week of class, and this is essentially the same equation. We've just put some different names on it. Okay, so we talked about flow down gradients. Flow is affected by gradient of some sort and resistance. And so when we're talking about blood flow, we're talking about the change in pressure. And so we apply this to the cardiovascular system. So it's the same thing. So in this case, Q, which is flow, equals cardiac output, which actually equals heart rate times stroke volume. Pressure, we're talking about the pressure gradient, and this is mean arterial pressure. What's really nice is we don't have to worry about the pressure in the blood returning back to the heart because it's nearly zero. And so just to make life simpler, we just go, well, what's mean arterial pressure? That subtract 0, which is your gradient, still gives you mean arterial pressure. And then there's resistance. And so you can see here that cardiac output equals mean arterial pressure divided by resistance. So as I've mentioned, there are multiple factors that affect mean arterial pressure. So heart rate. If we increase heart rate, we increase cardiac output, and by doing that, we increase pressure. Stroke volume is the exact same. I increase stroke volume, I increase cardiac output, which will increase pressure. We've talked about preload. More blood returns to the heart, that's going to increase stroke volume, which will ultimately increase pressure. Then you've got resistance. Okay, so if we increase resistance, we're going to increase pressure. And you can see this when you put your finger over a hose. Okay, we do that to increase the pressure of the water that comes out of that hose. We're going to wrap up with a couple of things here. So the first one is pulse pressure. This just gives us an idea of how strong that wave of blood is in your blood vessels. And it's easy to calculate. It's just systolic blood pressure minus diastolic blood pressure. So if you have a high or pulse pressure that's really high or really low, that usually means something's going on. So if you've got a low pulse pressure, that means you have low, or likely means you have low stroke volume, which means your heart's probably in failure or something's going on that's preventing it from contracting as hard as it needs to. However, if you've got high pulse pressure, that likely suggests something is wrong with your arteries. They're stiff, and so they're not going to expand to take in that blood, and so your heart has to pump harder. Typical blood pressure, 120/80. So in this case, your pulse pressure would be 40. And this leads us to mean arterial pressure. And this is the one that I believe is more important and we'll focus on more in class. Okay, and so in order to calculate mean arterial pressure, we have to take into account the fact that we're not in systole and diastole for the same amount of time. If you remember from our Wiggers diagram videos, we talked about how we're in systole for a shorter period of time than diastole. Okay, only 1/3 of the cardiac cycle is in systole, 2/3 of the time is in diastole. So it's just a weighted average. Okay, and so if we take our normal values, that gives us 1/3 times 120 plus 2/3 times 80. That gives us about 93. Okay, so there's two things I want to mention here. One, When I do this in class or on quizzes and stuff, we're going to do nice, easy numbers that are all divisible by 3. So I would never give you 120 over 80, but I might give you 120 over 90. Additionally, there are 2 or 3 other equations that you can use to calculate mean arterial pressure. They all work. So you don't have to memorize this formula if there's one that is easier for you to remember, because they will all give you the same values. So with that, we're done with our introduction into blood pressure. So can you do these 3 things? Define blood pressure, flow, and resistance. Can you identify factors that alter resistance? And can you describe the relationship between mean arterial pressure, cardiac output, and total peripheral resistance?